We asked over 1,000 individuals to take our Tinnitus Impact Quiz. Today, I will share the results. My name is Dr. Ben Thompson, audiologist, tinnitus specialist, and founder of Treble Health. Welcome to my YouTube channel. As I had shared, we created a Tinnitus Impact Quiz to understand how severe is someone's level of tinnitus. We asked 1,062 individuals in our community who have bothersome tinnitus to take our quiz, and the results are as follows. 9% had a mild degree of tinnitus, 27% had a moderate degree of tinnitus, 29% had a serious level of tinnitus, and 35% had a severe level of tinnitus impact. Our team of tinnitus doctors at Treble Health created the Tinnitus Impact Quiz based on research that looked at an abbreviated version of the Tinnitus Handicap Inventory. The study, which we will show on the screen right now, found that despite reducing the length of 25 items of the Tinnitus Handicap Inventory to 10, the Tinnitus Handicap Inventory shortened version can be used as a simple but reliable and valid tool for evaluating severity of tinnitus handicap, as well as detecting its negative impact on psychological functioning. I'm going to give you a demo of using the quiz right now. As you can see on the screen, we're able to answer questions based on yes, sometimes, or no. We ask a series of questions, and through your phone, you can reply by pressing the button. At the end of the quiz, you'll be given a score, and that score will show you whether you're in the mild, moderate, serious, or severe range. Just below this video, you'll find a link to the Tinnitus Impact Quiz, and if you have not already, I would encourage you to take that to learn how significant is your tinnitus and how does it compare to what others are going through. Based off of the survey results, we would recommend the following. If your score came out to a mild impact of tinnitus, then you can likely self-manage that through videos here on our YouTube channel. If your Tinnitus Impact Quiz score is moderate, then I recommend that you seek professional help and schedule a free consultation with Treble Health. If the result of your Tinnitus Impact Quiz was the serious impact level, then I would also recommend a free consultation over Telehealth with Treble Health, keeping in mind that the more serious your tinnitus is, the more likely it is that you'll need to take action to do something in regards to therapy or treatment. Finally, if your Tinnitus Impact Quiz is in the severe range, then I recommend that you seek professional help, have a telehealth consultation with Treble Health, and we encourage you to see your primary care physician, your nose and throat doctor, mental health counselor, to make sure that your mental health is in a good place. It's so important to us. We do not need your mind getting out of control. We do not need tinnitus becoming a major negative impact on your mental health. And there are real resources that can help you. When are hearing aids recommended for tinnitus therapy and tinnitus treatment? For those who have bothersome tinnitus but do not have hearing loss, our counseling services will be helpful. Occasionally, we recommend hearing aids programmed for tinnitus, and those would include sound therapy inside of the devices, as well as Bluetooth sound therapy that you can use for streaming. For those who have normal hearing, meaning no hearing loss, we would not use the amplification or the hearing loss function of the hearing aids. However, those devices are the best technology that's available in 2022 to treat your tinnitus. We see it over and over again, even with hearing in the normal range, having tinnitus maskers, devices on the ears, hearing aids that are programmed for tinnitus. Those are excellent. Those are helpful. I really want you to consider them and see how they could help you. And what about if you have a hearing loss? It turns out about 80% of individuals who have bothersome tinnitus also have hearing loss, in which hearing aids would be an appropriate recommendation. If you're working with one of our tinnitus doctors and you have tinnitus and hearing loss, the skill of the professional that you're working with, the skill of the doctor is so important. Having an audiologist who specializes in tinnitus is much preferred than trying to find anyone who works with hearing aids. It turns out that a lot of people work with hearing aids. There's a lot of audiologists, hearing aid dispensers, etc. that can sell you hearing aids, that can fit you with hearing aids. However, only a small percentage, I would say 5 to 10%, are really qualified to program them well for tinnitus. That might surprise you. It surprised me when I learned this, but most audiologists are not experts in tinnitus, ringing in the ears. That said, if you have hearing loss and tinnitus, it makes a lot of sense to consider hearing aids. When they're programmed by an expert, by a doctor, then they're going to be working at the best of their capabilities. Over the past years, we've been looking for innovative ways to improve the convenience and the access and the cost of healthcare. And for tinnitus, it's so important to get the right kind of treatment as early as possible. Hearing aids can now be programmed remotely, meaning that we at Treble Health ship them to your house. We have an initial programming session based on your hearing test that you get from an in-person clinic. And with all of that together, we can adjust the devices from your phone into your ears and provide exceptional audiology care via telehealth, where it's not only convenient and helps you treat your tinnitus, but we're also able to see our appointments much faster and really help you during those initial periods, which are often so troublesome and challenging. If you've already taken the Tinnitus Impact Quiz, let us know your result. Let us know if you have further comments for our community. And if you have not taken it yet, you can find the link below. My name is Dr. Ben Thompson, your friend, your guide, and your YouTube audiologist. I wish you well, and I'll see you on the next video. Bye-bye. Thank you for watching today's video with Treble Health. Check out our next video by clicking the button on this screen or another recommended video. And if you're not already, make sure to subscribe to our YouTube channel. Thanks so much. See you on the next video.